respectful, as you'll be ejected from the meeting and you will then be unable to re-enter. So like I said before, I'm your host for this evening. My name is Niamh Feeney. I'm a former secretary and current member of the board of the Abortion Rights Campaign. I've been involved in pro-choice activism since 2017. I am a mam, a wife, a nerd, and a Gaeilgeoir. Don't worry, the panel's not going to be us Gaeilge. I'm also delighted to be chairing a panel filled with a bunch of my favorite trans voices from Twitter. To introduce them in their own words, they are Alicia Nielanagon, who has been active in radical women's circles, cis and trans, for over 2 decades. Her activism around trans issues focuses on trans women, their access to quality healthcare, employment rights, poverty, and trans misogyny within feminist and queer communities. In the early 2000s, Eilís and her adopted trans sister, an MD who is also an abortion provider, started one of the earliest known trans women run and operated trans healthcare clinics, providing low-cost surgical options for low-income trans women. In 2015, she organised the Nevermind the Hormones tour of trans women authors throughout Ireland and the UK. She lives in rural County Leitrim with her cats and a dodgy internet connection. Adeline Berry is an intersex and transgender researcher and board member of Intersex Ireland and Sex Workers Alliance Ireland. They have collaborated on an Eisner Award nominated comic, owned tattoo shops in Florida and Texas, earned a 2nd degree black belt in karate and a BA honours in psychology from the Dublin Business School. They've spoken at conferences in Stockholm, London, Limerick, Cork and Dublin on the intersection of gender, sex work and the law. Research includes Giving Voice to Diversity in Criminological Research, Nothing About Us Without Us, with Maynooth University and HIV Ireland, and Life for Sex Workers in Ireland under the Swedish model of client criminalisation. They are currently working on their PhD studying the lives of older intersex individuals as part of INIA, Intersex, New Innovative Approaches, at the University of Huddersfield. Aoife Martin is a trans woman and activist. She is a columnist with the Journal and sits on the board of TENI. Alexa Moore is a trans woman and human rights activist based in Belfast, Northern Ireland. She is one of the founders and directors of Transgender NI, a not-for-profit which supports and advocates for trans communities in Northern Ireland and is a member of the Northern Ireland Women's Policy Group. Noah Halpin is a 29-year-old transgender man from North County Dublin. Noah is the Community Aid Officer, Healthcare at the Transgender Equality Network Ireland, TENI, and is also the founder of the This Is Me Transgender Healthcare campaign, which advocates for safe, accessible, best practice, person-centered healthcare for all transgender and non-binary people in Ireland. Noah has a particular interest in both sexual and reproductive health and is also an active member of ACT UP Dublin and is passionate about the improvement of sexual health services nationwide, as well as ending the HIV crisis in Ireland. And so without further ado, I'm going to turn you over to our first speaker. That's Eilís. Thank you very much.
No? Okay, I'm not unmuted now. Hi, I'm Eilís. As you can tell, I wasn't born in Ireland. I transitioned about 26, 27 years ago in the United States. And when I moved to Ireland, I got very nostalgic because the Irish trans healthcare system reminded me of 30 years ago back home, where it was very top-down heavy on gender conformity and you know, when I moved here, I had come in with enough medication for myself for a couple of years, actually. And when I ran out, I decided I'll just go to my GP. And my GP said, oh no, you're going to have to go through the gender clinic thing. And I had heard the horror stories, and the wait list at that point, I think, was 2 to 3 years. And I said, to use a phrase from back home, that horse done left the barn. My transition is literally older than your medical degree. And right now, my bones are turning to dust. How do we solve this? And Her answer was, we don't, you go to Loughlinstown. So at that point, I did what trans women and other trans folks all throughout the world have done. When they have hit roadblocks, I have gone around them in various ways that I'm not going to admit here. But this is, from a historical perspective, this is very similar to some of the work that we ended up doing in the United States. My adopted baby trans sister, whose name I can't tell you because she's an abortion provider in the United States and literally has to wear a bulletproof vest when she goes to work, because the other abortion provider at the clinic that she works at was killed. She was in her residency for abortion, and she was telling me about the story of the Jane Collective, which was this collective of women in the Chicago area prior to Roe v. Wade, which legalized abortion in the United States in 1972, who basically said, you know what, let's not wait on this. Let's figure out how to do abortions ourselves and be able to provide them. So she was telling me this story, and I had known some about it, and we came up with the idea, well, this would map over very well with some of the work that we're trying to do with trans healthcare. So we started our own little surgical clinic, which was shockingly legal. And the clinic ran for about 2 years and provided low-cost surgeries for trans women and hormonal care, as well as I'm forgetting the word here, electrolysis care. So from the world I come from, I'm very used to having to go around systems that want to control trans folks. This is, like I said, very nostalgic for me because, you know, Ireland has first-class trans healthcare if you get in a time machine and fly back to like the 70s or the 80s. And that has been my experience as a migrant trans woman in Ireland.
Cool. Thank you so much for sharing that, Eilís. Sorry, it took me a second to find my notes. So I'm going to move on. Adeline, would you like to share your experience, please?
Hi, I'm Addie. Thank you very much for having me here today. As far as I can tell, there's essentially no healthcare for transgender people in Ireland. If there is, it's the bare minimum they can get away with. It's a box-checking exercise. I'm seeing transgender people crowdfunding and flying elsewhere to get the care they need. I myself have been on the waiting list to be seen at the National Gender Service since July of 2017. For those lucky enough to reach the end of the HSE's long waiting list, they're shipped to England for care, where transphobia runs rampant in the media, and anti-transgender activists are successfully rolling back trans care with the help of Paul Conrath, a solicitor known for fighting gay rights and access to abortion. I don't want to criticize the frontline workers of the HSE while they battle with a worldwide pandemic, and I'm not going to. This has nothing to do with the frontline workers and everything to do with those in positions of authority. Just as anti-sex work gatekeepers with strong ties to the Catholic Church sit in all relevant positions of authority in Ireland, the same appears to be true for transgender care. In 2017, I was denied access to antidepressants while suicidal by a psychiatrist I was referred to by my GP. That for many years used to be the head psychiatrist for the National Gender Service. Can you imagine turning away someone that's suicidal? I certainly can't. Now imagine being a psychiatrist and turning someone away. A former psychiatrist for the National Gender Service. A week later, he was on his LinkedIn posting about watching out for LGBT clients because we're at a higher risk of suicide. I'm left to wonder how the transgender people in his care fared. I'm left to wonder, did he work in that position for many years while keeping his anti-trans views to himself? Or is there a culture of transphobia at the top of the National Gender Service? There appears to be a pattern of gatekeepers being in positions of authority in Ireland's National Gender Service with either transphobic leanings or very uninformed and skewed understandings of what transgender people are. Until recently, the National Gender Service was run by a man that thinks the rise in numbers of trans people in Ireland is due to the popularity of Caitlyn Jenner. It's not. He also does not return emails in my personal experience. I'm not just a transgender person, I'm intersex, which means I was born outside of the strict medical definitions of male and female. There are as many intersex people as there are people with red hair. We make up as much as 2% of the population. Almost without exception, we are assigned to one of two genders, and irreversible surgeries that are not medically necessary are performed on us without consent to cement that decision. Doctors call these social emergencies. We are fed hormones before puberty if doctors feel we need a little push, or to compensate for being castrated as children for no valid medical reason. Many of these surgeries leave us with a lifetime's worth of medical, social, and legal difficulties, but with zero recourse. We call these surgeries IGM, or intersex genital mutilation. Ireland criticises FGM while continuing to perform IGM. Ireland is right to criticise female genital mutilation, but criticising female genital mutilation while continuing to perform intersex genital mutilation is racism. The procedures performed under FGM are included amongst the surgeries performed regularly in IGM. Now, not all intersex people are transgender, and not all transgender people are intersex. But when doctors are randomly assigning genders to babies with ambiguous genitalia, there's going to be an overlap. There used to be a saying amongst doctors that it's easier to dig a hole than to build a pole, due to the relative ease of constructing a vagina compared to constructing a penis. So, why are Irish intersex children undergoing medically unnecessary surgeries as babies, but then being denied life-saving care afterwards? I'm a transgender person because I'm an intersex person that was assigned the wrong gender at birth and then operated on and fed hormones. I'm a sex worker because I live in a world where when doctors assign you the wrong gender at birth, it will haunt you for the rest of your life. Because of employment discrimination, transgender people are overly represented in sex work. On the LGB Alliance webinar today sits a woman that was tasked with performing research for the Irish government on the success of laws Ruhama, the NGO that she used to work for, fought to bring in. This NGO has received millions in funding while being allowed to inform policing on sex work in Ireland. I think it would be bad if an organisation the Irish government trusts implicitly with regards to sex work was transphobic, considering how many of us are engaged in sex work. On the anti-trans activists scaremongering over on the LGB Alliance webinar, Ruhama has employed at least one of them and platformed 2 more. When Ruhama was asked by a transgender sex worker in 2019 why Ruhama was planning to platform anti-trans activist Julie Bindel, they replied, "We just want her for her views on sex work." So, who else wants to see transgender people erased? Powerful right-wing organizations like the Family Research Council and the Heritage Foundation, and the Vatican, the kind of people Paul Conrath represents. All 3 of these organizations have fought hard to curtail reproductive rights for women, one of them for centuries. Like it or not, know it or not, we are all in this fight together. Sex workers and transgender people and intersex people are the canaries in your coal mine. In a country where we are safe and secure, so are you. The church and state alliance that took away women's rights to get divorced, to serve on juries, to work after marriage, that banned sex work and contraception in one go in the 1930s, still exists today. It's the same political parties, the same Catholic Church, repackaged as progressive feminist NGOs. In 2017, they brought in a law that was designed to target African migrants in Sweden. based on research paid for by the Religious Sisters of Charity. This 2009 research claimed that the sex industry in Ireland was worth €180 million a year, based on Ireland having at least 800 sex workers that work 6 days a week and bring in close to $250,000 each. There is no sex industry in Ireland. There's a poverty and inequality industry and vulnerable people trying to house and feed themselves and their families. There is, however, an NGO industry that does bring in millions. The laws they have brought in have increased violence against sex workers 92%. We are being arrested and jailed for working together for safety like Gardaí do. Trafficking has increased dramatically in Ireland. In just 3 years under this law, we have dropped from tier 1 to tier 2 watch list on the Trafficking in Persons report, just above Afghanistan. Sex work laws, Catholic sex ed, and Catholic shame and stigma has contributed to driving our HIV numbers to their highest ever. Until recently, Catholic NGOs were planning to open direct provision centres to house the sexually exploited. These same NGOs have been working to obfuscate sexual exploitation, human trafficking, and consensual sex work since 2009. Now they will run reception and integration centres where people who are trafficked, fleeing violence, sexual violence, who are LGBTQIA, disabled, or who are older will be directed to an appropriate setting. When your NGO platforms and hires people who work towards our extermination and introduce laws that get us evicted, jailed, and deported just for trying to survive, I'm led to wonder what they might consider an appropriate setting. It is time to separate church and state. Thank you.
Thanks very much for that, Adeline. That was very informative and gave me a good shot of the old-fashioned activist anger I haven't felt in a little while. Appreciate that. Aoife, would you like to share your experiences with us? Thanks.
Sure. Hello, so my name is Aoife Martin, and it's nice to be here today among all of you. And it's just interesting listening to the previous speakers. Also, I realised that my bio seems to be very short compared to everybody else, so I'm going to have to add a few lines to that one, I think. But you know, compared to Adi and Eilís, I've been through the HSE system here. So I've been through the Loughlinstown system, the National Gender Service. I was referred by my GP in 2017, and you know, for a start, I was lucky enough that my GP knew where to refer me, because there are GPs up and down in this country who don't know where to refer trans people, or who don't believe trans people when they tell them that they're trans. So, you know, straight away I hit the ground running. So when I was referred, the waiting list was about 12 months. And once I got in to see the people at the National Gender Service, I assumed that I would be put on HRT straight away, but that was not the case. I was immediately referred to a psychiatrist. This was despite me having a letter from my counsellor saying that I had been seeing her for 2 years at that stage with regards to my gender identity. So I was referred to a psychiatrist in St. Patrick's Hospital. And this is before they would even consider putting me just on hormones. This wasn't about surgery, it wasn't about anything else, it was just about being put on hormones, something that GPs up and down the country prescribe to cis women day in, day out without an issue. But because you're trans, you have to see a psychiatrist first. So I went to see this psychiatrist in the in St. Patrick's Hospital, and it was a really interesting and somewhat dehumanizing experience. The psychiatrist in question, you know, he asked me lots of very, very personal questions. Asked me about my, you know, questions about my relationships, about my sex life, and also while talking to me, he was dictating a letter to Loughlinstown about me. So while he would ask me some questions, and then he would stop and speak into his dictaphone as if I wasn't there, speaking about me in the third person. and he described what I was wearing. He said, and Aoife is wearing makeup today, and she's wearing a short skirt and boots, and she looks feminine today, and Aoife is overweight. And you know, so, and I'm sitting right there just listening to this guy describing me to his machine. But to cut a long story short, he determined at the end of the process that I was indeed transgender, and I said, well, you know, tell me something I don't know. And I was sent back to Loughlinstown. So when I went back to Loughlinstown, they put me on hormone blockers for, I think, about 6 months on hormone blockers. And it was only after those 6 months that they then put me onto actual hormones. Okay. And so this went on for a while, and then, you know, eventually I said to him, look, I would like to be referred for surgery, please. And yet another round ensued of talking to psychiatrists, because apparently bodily autonomy is not something we allow transgender people in this country. So I had to go and speak to a psychiatrist about my surgical referral. I spoke to this person for, it was a 4-hour session, and it was probably one of the most difficult things I've ever had to do. I spoke to him. He asked lots of questions. He took me from my early childhood up to the present day. He asked me lots of questions again about my sexual relationships, my sexuality, you know, stuff that was very, very private and very, very personal, about my relationships with my family, and things that, you know, that even in things that you wouldn't even tell your closest friends sometimes, you know, that he asked you to do such very, very personal questions. And I was just, when I got through that session, I just came home and I just cried, because I was just, you know, it was so raw and emotional, and it opened up so many wounds, stuff that I thought had healed and scabbed over. And it just left me feeling really, really drained and exhausted. So it was very, very tough. But I got through that session, and they determined that yes, I was suitable for surgery. So again, you know, the way it is in this country is that you are referred to England, I think, as Adi was saying. So so I was referred for surgery in Charing Cross in London, but along comes COVID, and that sort of put everything on a halt at the moment. So I've got all the referrals, I've got the HSE approvals and everything, but we're currently in a holding pattern because of COVID. But it's very, very interesting that, you know, we're speaking here today with ARC, and it's interesting that we seem to send our problematic people abroad. You know, we send our problematic women abroad, we send our problematic trans women abroad, we send our problematic trans men abroad, because Ireland just doesn't like dealing with these sort of things. So I think that's, you know, there's an interesting conflation there. And so that's sort of where I am at the moment. I'm in a holding pattern. I'm lucky. I feel privileged that I am receiving healthcare from the HSE. I'm one of the lucky ones. I've got through the system. I've jumped through the hoops, and I'm just now in a holding pattern. So, and every 6 months I have to go up to Loughlinstown, and you know, they take my bloods, and they weigh me, and they do all the necessary things that they do, and then they renew my prescription. So and that's currently where it is at the moment. So yeah, we'll see what 2021 brings. Thank you very much.
Thanks for sharing that, Aoife. I think it strikes me that you feel privileged for having, even though you've had to jump through all of those things, it's something that I know that I identify with. I sometimes feel like, oh, well, sure, I'm being awkward here, but no, it's the system that's not serving us. It's not appropriate. Thank you for that. Alexa, do you want to share your experiences as a trans person in Northern Ireland?
Hi, thank you so much for having me. So my name's Alexa Moore. I use she, they pronouns. And I live in Belfast currently. I'm from the kind of border region between Newry and Dundalk. And I'm one of the founders and directors of Transgender NI, which is a human rights organization focused on supporting and advocating for trans folks in Northern Ireland. We run the Belfast Trans Resource Centre, which is a dedicated trans community space in South Belfast. In terms of kind of my access to healthcare, it's not really that exciting a story, because I haven't, because it's hard. You know, by the time I went to my doctor about trying to access kind of hormones or anything like that in 2018, January 2018, the waiting lists for the only adult gender identity service in Northern Ireland, the Brackenburn Clinic, had basically ground to a halt. No new patients were being taken in. And so there was a period of about two and a half to 3 years, and even now it's still kind of rocky, and we don't really know what's happening in there, because it's just so obtuse and so opaque. So I was forced to kind of go elsewhere for my healthcare, and that's really the story kind of across Northern Ireland for most trans people right now. If you didn't get in before roughly January 2018, then tough luck. You missed the cutoff date. I'm so sorry. You have to go private, or you have to self-medicate and kind of go down that rocky road. So it's been really quite awful for the past few years in Northern Ireland. The young people service is still kind of operating at in their very far from best practice ways. And I mean, Adeline is absolutely right when she says that, you know, there's pretty much no access to trans healthcare on the island of Ireland, north or south. It's pretty much just non-existent, and where it does exist, it is delivered in such a stigmatizing and such a pathologizing way. I mean, we kind of we've heard a little bit about the way that these clinicians and psychiatrists kind of force gender roles on the people who go through their services. We hear of people all the time, whenever the services were still kind of up and running at full function, we heard all the time about people who had, you know, their GIC suit and their GIC dress that they wore to you know, basically make things easy on themselves, make sure that at least they tick one box a little bit well, that they're living in role, as the specialists put it. So yeah, it's been quite awful. There has been a review commissioned into how the services are operating in Northern Ireland, the pathway up until access to surgery. They're not looking at commissioning surgeons or anything like that, because that'd be a step too far. So that review has been going on for about a year and 3 months now, and it really has just it's laid bare how central cis viewpoints and cis opinions are to trans healthcare, and how much they're valued, and how much power they're given over trans experiences. We put in a freedom of information request, because that's the only way that we can get any answer out of these people. And there were, from my memory, there were about 8 mental health professionals, 8 people working in mental health on the review panel. Only 2 people working in sexual health, which was a choice, and 2 quote-unquote service user representatives. They didn't come from a trans-led organization, I can tell you that much. It's all been a mess. They're setting up a service user liaison panel a year into it, with absolutely no idea about what that service user liaison panel is actually expected to do, whether they'll be a rubber stamping body to basically give the department a free pass for doing their inclusion round tables. So really, it's all up in the air, and it is the same story, north and south. Trans people aren't a priority. You know, whenever we got marriage equality passed, it's like, right, okay, we're done now. The LGBT community is sorted. It came a bit later for Northern Ireland, but you know, I'm glad we got it over the line, folks. But there really is still a whole lot to do, and I mean, I don't need to tell you that. You've already heard it multiple times. But I do think that whenever we're talking about this, that, you know, there's a tendency to present the problems and kind of, you know, be a little bit wishy-washy about the solutions. And I feel like that leaves room for cis people and cis viewpoints and cis opinions and cis power to remain entrenched in trans healthcare. We need to make sure that we think radically about models of care for trans people. We need to think about it as centered around trans people, centered around the individual, not forcing people through mental health assessments or forcing people through these really rigorous and invasive, almost interrogations, is how a lot of folks put it. And moving away from that, having services delivered by and for trans people, entrenching trans people within those, and you know, challenging that idea that these cis psychiatrists have any right to call themselves gender specialists. They demonstrate time and time again, as you've heard from multiple people tonight, that they know virtually nothing about trans lives, trans identities, trans experiences. The way we experience our gender, it's fundamentally different from person to person even. So that really is just kind of, we need to think outside the box, think a little bit radically on this. And we also need to ensure, maybe this is my kind of the token Nordy of the evening saying it, but we need to make sure that there's cross-border development of new services. If we can, you know, talk about the need for a surgeon, for instance, to perform gender affirming healthcare surgery, north and south, covering both of those constituencies, it'll be a bit of an easier case to make if we're pooling resources, if we're thinking about people, for instance, close to the border regions, who might be even, you know, I know a few folks who have one half of their house in the north and one half of their house in the south. You know, which gender identity service do they go to? We need to kind of decentralize it as well, because right now in Northern Ireland, it's only based in Belfast, and that does nothing for an incredibly rural population, as we've already heard. And you know, as well as that, kind of the trans healthcare side of things, there's still, as Adeline mentioned, intersex genital mutilation that's carried out in Northern Ireland as well as in the south. These are all things that do need to change. There is an LGBT strategy that is coming out. We'll see how closely the Northern Ireland executive adheres to a strategy. They don't have a good track record, I'm going to be honest with you. They usually give up after like 2 years, but we'll see. No high hopes, but you know, there's been a lot of work put in from across the sector, to including a lot of different issues for all of our communities. So hopefully things will start changing in Northern Ireland, but we do need to keep fighting. And just lastly, before I run out of time, I do want to raise the fact that abortion, access to abortion care in Northern Ireland is something that almost does not exist as well. You know, we got a win last year with the legislative framework that was introduced through Westminster. However, right now, you can only actually access abortion up to, as far as I'm aware, 10 weeks. And even then, it's patchwork. There was, I think, a month or two, or maybe a few weeks, where the Northern Trust wasn't able to offer abortion care because they didn't have the capacity, because the Department of Health and the Minister for Health, excuse me, Robin Swan, is refusing to commission abortion services. It's too controversial, apparently. My goodness. So it's incredibly patchwork there in terms of reproductive justice and reproductive healthcare across the board. This is something that, you know, we work on with women's sector colleagues and feminist communities in Northern Ireland. You know, we have pretty good working relationships. That kind of culture war and the fighting, the infighting that has happened across Britain, you know, it didn't hit us as hard. So we do need to capitalize on that and work together and use each other to push all of our movements forward. Thank you very much.
Thank you so much for that, Alexa. I like that you're as well as describing the problems, you're also focusing on, moving forward. And once again, drawing the parallels between the fight for transgender healthcare and also for abortion care needed on the whole island of Ireland. And so I'm going to turn the mic over to Noah now, who's going to be the last first speaker. And then we are still taking questions for the Q&A in the chat. You can send them to our volunteer moderator. Thank you so much.
Hello, everyone. Thank you so much for having me here today. I'm delighted to be able to speak on a panel of some wonderful women, and a very happy International Women's Day to all women here. If it wasn't for, women of all backgrounds and all histories, I and lots of women in this country wouldn't have, some of the rights that we do have today. So a very happy International Women's Day to all of you. So I guess, my experience of obtaining trans-specific healthcare in Ireland would be quite similar actually to Aoife's, and it's not a story that's unheard of. It's not a story that's exclusive. It's a story that we hear from most trans people day after day here in Ireland, and it is absolutely something that needs to be addressed. So thank you to the Abortion Rights Campaign today for opening up this discussion for us to have. So I guess my story kind of started, I realized that, there wasn't something wrong with me, but there was something different about me from quite a young age. I had, always considered a tomboy when I was little, refused to, the amount of times my mother would wrestle me into a dress for some sort of event on the floor with tears and snots and everything as a kid. Now, I always knew that there was, like I said, something a little bit different about me, and I came to the realization when I was about 14 or 15 years old that I was in fact transgender. And the way I came to this realization is I knew there was something, and I tried to, talk to myself and say, are you a lesbian? Are you bisexual? But none of those things seemed to fit. And it wasn't until I was 14 or 15 that I saw a documentary about a young trans girl, and a light bulb went off in my head, and there was no devastation or upset. It was this kind of relief that, oh my God, there's nothing wrong with me. There's a word for this. It's transgender, and that's what I am. But unfortunately, I was in an all-girls boarding school at the time, so it wasn't the right environment or even a safe environment for me to be able to come out at the time. So I sat with that for many years, until, how old am I now? I'm losing track. I'm 29 now. So I think I was about 23 when I decided, I had to do something about this. And it was only for, going on my own journey did I discover how difficult obtaining healthcare actually was. And when I figured out how hard it was for me, I figured out that it was the same for everybody else. So I went to my GP thinking, I'll just go to my GP, I'll tell him I'm trans, and he'll be able to give me hormones, and it will be fine because he'll believe me when I tell him that I'm trans. And he did, but he didn't know what to do with the information. It took 2 attempts for me to go to my GP and tell him that I was trans, because I've known him all my life and I was really nervous. The first time I wimped out and ended up talking about my foot. There was nothing wrong with my foot. The second time I did tell him, and he said, that's fine. And, he understands, but I don't know what to do with that information. And, it was something that I'd hyped myself up to do. And I came out of his office with no answers or no way forward. So he told me to go home and to do my own research and figure out where he has to send me, and come back to him with that information. And I did. And I figured out that, I needed to be referred to the National Gender Service at Loughlinstown. Well, it wasn't called the National Gender Service then, it was just called Loughlinstown Hospital. And that's what happened. But when I was referred, I found out that there was a waiting list. And at the time, they told me that the waiting list was about 2 years long. Unfortunately, they lost my referral twice. And it got to around the 2.5 year mark when I realized that they'd lost my referral for the second time. And I guess I did what any upset trans man would do. And I drank 2 bottles of wine, got drunk, and created a protest online. I had never organized a protest in my life, and I had no idea what I was doing. But that's where my kind of activism started. It started by going through the system myself, and then realizing that, my case wasn't exclusive, that everyone else is going through this as well. So the way it worked was that it took about 3 years for me to actually be seen by the National Gender Service. And similar to Aoife, I sat through what was for me to three and a half hour psychiatric assessment, where I was asked questions like, what kind of porn do you watch? Who do you have sex with? And when you have sex, what are the mechanics of how you have sex? I was asked about any past abuses, my parents' relationship, as if, I don't know, a fight they had when I was 6 turned me trans or something. I was asked about my birth to now. But there was a heavy focus on, hypersexualized questions, questions that bore no relevance to my gender identity whatsoever. The people that I decide to have sex with has no relevance to the gender I identify as most people would understand that sexuality and gender identity are 2 different things. But it seems that hasn't changed in the National Gender Service quite yet. And if people are resistant to answering those questions, you can be sure that their treatment will either be delayed or denied, which we've seen cases of time and time again. So then after that, anyway, I had my psychiatric assessment at the National Gender Service. And such as Aoife said, it was very much taken into account what I was wearing, down to describing my shoes and my shirt. And I thought, I really had to present very masculine in order to obtain HRT. Now, at the time I went through the service, initially, there was no second assessment. But at the moment, by standard, there's a second assessment after this 3-hour-long assessment. And that's if you get through the system okay. Once you have 2 assessments, your case is brought before a multidisciplinary team at the National Gender Service, and they all decide together whether you go forward for hormone treatment or you don't. If you go forward, there's about another 3 to 4 month wait, could be longer at times, to see the endocrine team, and that's where you will hopefully be prescribed hormones if that's what you need and that's what you want. And even that in itself was difficult for me. They were quite adamant to put me on a form of testosterone, which is a gel testosterone, but you can also go on injectables. And I had pre-decided that, gel was not the right treatment for me. It's transferable. And at the time I was a childminder to 2 young children. So I decided that it wasn't safe for those children for me to use a gel method for fear of transferring. I also had pets, which it's the same risk. So I decided that injectables were best for me. It took a while of I wouldn't say arguing, but convincing the consultant to prescribe me this method of testosterone. Again, they weren't very much taking into account what I had to say or my needs or what was appropriate for me at the time. Anyway, I won that argument. I got my injectables. But when I asked them how I have them administered or how I administer them myself, I was told, we only prescribe, we don't administer. And I was sent away with a prescription for injections with no knowledge as to how I do them myself or how I get them done. I approached a public health nurse who said, we've never done testosterone, so I can't do it for you. In the end, I was holding this prescription in my hand that I'd waited so many years to have. I ended up having to learn from YouTube how to do an intramuscular injection. And that's how I learned. And there was, God, many a times that I messed it up and ended up, limping for a good 8 to 10 days or, things like that. So that's where trans people are often, we often end up having to learn these things ourselves that people go to medical school for. What we also end up having to do is, nearly in all situations, is learning how to be our own doctors. And I don't just mean that when it comes to trans-specific healthcare. I mean, I would consider trans healthcare any form of healthcare that helps a trans person to thrive and survive. And that is all corners of healthcare, be it diabetic care, be it reproductive care, you name it. Any healthcare that a trans person needs to thrive and survive is trans healthcare, in my opinion. So we end up having to teach our doctors in different sections of healthcare, what's actually right for us. They don't understand, a lot of doctors don't understand hormone therapies and surgeries and things like that. And even endocrinologists who are said to be specialists in the area, I've had to correct on my blood readings and my care and my medications, and I turn out to be right. And it's only because I pay particular attention to my own healthcare that things aren't missed, and I'm on the right treatments. And then it kind of takes me to surgery as well. In Ireland, we don't have any surgery options for transgender people. We had one surgeon who was providing what we would call top surgery, which is kind of self-explanatory to trans people. She retired last year, and the HSE haven't, nor do they plan to replace her position. So that leaves us with no options. For trans masculine people, we have one private surgeon that is willing to perform this surgery on trans people, though her cost is about €12,000. She has a strict criteria for referral, so it's not accessible to the majority, or even just less than a handful of trans people in the country. So what that does is, and this might sound familiar to a lot of people, is it pushes this whole cohort of vulnerable people abroad for major invasive surgeries and procedures with little to no aftercare when we get home. So for me personally, I had to have my top surgery. So that's a double mastectomy. And I had to have that done abroad in Poland. I had to travel with one friend because they won't do the surgery unless you take someone with you. And bear in mind that not every trans person has someone that can go with them or will go with them. And I'm very, very fortunate and very lucky that I do have a very good network and very close family, as I'd call them. And one of my best friends, Will, came with me. But all of a sudden, I was in a country I'd never been in. I was in a country that I didn't speak the language and they didn't speak mine, and it was difficult. Not only, trying to prepare myself for surgery, it was difficult trying to figure out exactly what was going to happen because the language barrier. And I was very much on my own, and not just myself, but my friend Will, who came with me, was very much on his own. He wasn't a doctor, he wasn't medically trained. And all of a sudden he was isolated from any supports, and, he had to care for me. I got out of the hospital within 24 hours and he had to care for me like a nurse. And if something went wrong, he was there alone. But I had this surgery done in Poland. It was quite a large surgery, the double mastectomy, and I traveled home 8 days later. Unfortunately, it was a bit soon after surgery, so not all of my stitches were out. I still had stitches across my chest and my nipples, and I had to fly home on a plane. I couldn't use my arms. If you imagine maybe little T-Rex arms, that's as far as you can move them post top surgery. And so I couldn't lift anything, I couldn't pull anything, I couldn't reach up, out, down, you name it. Will had to dress me, Will had to wash me, and then traveling home on a plane straight afterwards was incredibly difficult. And any kind of post-surgical complications that happen afterwards, it's very hard to get care for at home. Most recently, I travelled with my friend Fionn to Poland again. We only got home last Friday week. Fionn was forced to travel during a pandemic. He's been on a waiting list for this surgery in Poland for 1.5 years. Cancelling or postponing that, he wouldn't be seen for another 1.5 to 2 years. So there was no option other than to go. We didn't want to go. We didn't want to travel. We especially didn't want to travel in a pandemic. And what made that much more difficult is the fear of Fionn had to have a COVID test before his surgery, and the fear of traveling all that way and having to just cross our fingers and hope he didn't test positive the day before his surgery or the day of his surgery. Otherwise, all the money he had to raise was gone, and we were stuck in a country for no reason. So fortunately for us, we did everything to avoid contracting COVID. The flight was full, there was no social distancing on the flight, masks weren't being enforced, but we could only look after our own health. And, we bought top spec PPE and did everything we were supposed to do. Unfortunately, we were both COVID negative. Fionn had a surgery, but, with restrictions, I couldn't wait in the hospital for him, and I had to sit at home and hope that he was going to come out of it okay. He doesn't mind me saying, I've already gone through with him. He's a type 1 diabetic, so there was a little bit more risk involved there. And the hospital, of course, forgot to call me, and when I called them, no one could speak English. So I went through till about 12:30 at night, not knowing whether he'd gotten through it okay and things like that. Luckily he did, and we were to travel home 8 days later. We had the same surgeon, and I mentioned to the surgeon while I was there that, unfortunately, I found out that there was a surgical clip that was accidentally left in my chest during my surgery in 2019. And I only found that out because I had spinal surgery in last July that showed it up in an x-ray. So I mentioned that to the surgeon while I was there. And also I had a little problem on the side of my chest since surgery. And I didn't expect him to say it, but he said, I'll do a surgery on you on Friday. And I said, oh God, I only came here to care for Fionn. I'm not prepared for a surgery. And, it was essentially told to me that if I didn't get it that Friday, I'd have to wait a couple of years to have this looked into, and I'd have to pay a lot of money to come back to Poland. So I said, I can't have this surgery done under general anesthetic because I fly home the same day. And he said, look, I normally do general anesthetic, but I can do it under a local anesthetic for you. You'll be wide awake, no sedation. You'll be alert, but I can do it. So I said, I'll go for it. So last Friday week, I had surgery on Friday morning, and I flew home to Ireland on that evening, just a couple of hours later. Fresh incision, about 30 centimeters under my arm, along my rib cage, which I'm still recovering from. But I guess one of the worst parts of it is that we tested negative for COVID coming back on Thursday. We flew Friday, and a couple of days later, we tested positive. So once we came home, we were both recovering from surgery, and now we've both tested positive for COVID from the flight. It seems that we got it. Now I am symptomatic. I'm okay tonight, thank God. I'm a little bit better, but I have been, not very well, and Fionn hasn't been very well either. But we had no choice. We were pushed abroad by our healthcare service here. In terms of lower surgery, there's no options at all in the country, and we're all forced abroad for that. And it's only the select few who are under the treatment of the National Gender Service that can get that done under the Treatment Abroad scheme or the Cross-Border Directive. But the majority of trans people aren't yet seen by the National Gender Service. The current waiting list for the National Gender Service stands at 3+ years at the moment. So that's from first referral by a GP to your first appointment for your psychiatric assessment. That is about 3+ years. And in terms of the assessment process and the model of care there, that is, we are not abiding by international best practice standards of care. International best practice standards of care suggests an informed consent model. We're currently operating a non-evidential based model of care, psychiatric model of care, and very much an autogynephilic model of care. That was created by one individual in that service, and it's not based on any sort of evidence. And God help you if you try and challenge that model of care in any way, shape, or form. Our service also considers trans people who might have autism, personality disorders, a history of mental health difficulties as having comorbid conditions. You can be autistic and be transgender as well. They're not mutually exclusive, but for some reason in their mind they are, and they use it as this gatekeeping tool to delay or deny healthcare to people. And we need to change that. We need to start abiding by the WPATH, which is the World Association for Transgender Health's international best practice standards of care, and start practicing an informed consent model, because the model we use here in Ireland, it's based on us having to prove ourselves and not us being believed. And that is something that comes through very much in bodily autonomy. And different kinds of healthcare, when we talk about reproductive healthcare for, say, trans men, oftentimes if we're having any sort of issues with our reproductive system or things like that, they almost try and force us to have a hysterectomy because they can't explain it. They don't want to look into it any further. But if a woman or a person decides to come forward and want a hysterectomy because they don't want any more children, or they don't ever want children, or they wanted to treat endometriosis or anything like that, they're point blank refused. And that's the difference in autonomy when it comes to, say, things like hysterectomies. Compared to if you're trans or if you're not trans, we're almost forced into it. Whereas, a lot of cis women are also often denied it, because they can't make decisions for themselves, which is absolutely ridiculous. And I guess also when it comes to things like sexual health and reproductive health, language is so important. You know, even in sexual health, we're advising, you know, if you're dealing with a trans person, you don't need to use the words vagina all the time. You know, it can make a lot of trans men very uncomfortable. Using the word frontal can help a lot to make someone comfortable, and it doesn't take anyone else's, you know, rights away from them. So language is very important, as well as encouraging people to go and get, you know, screenings that are very much needed. I still need cervical screening. Of course I do. It's still very important that I get it. But language and people, a lot of healthcare professionals' ideas of our bodies and assumptions of our bodies make people fear going for those really essential tests. For a long time, medical professionals thought that cervical cancer rates in trans men were higher because of testosterone use. We then found out that cervical cancer rates in transmasculine people are higher because a lot of transmasculine people weren't going to get screened because it was uncomfortable for them, and the language they used were uncomfortable, and people's understandings of our bodies were uncomfortable. So, you know, that's why language is very much important in a healthcare setting, especially when it comes to trans people. And I guess, yeah, that's just a little bit of my story, and as well kind of the things that we need to do to improve trans healthcare in Ireland. You know, I know Alexa spoke about decentralizing trans healthcare from clinics and opening it up to the community. We're trans, we're not sick, we don't need to be in this one hospital. You know, by opening trans healthcare to GPs who provide HRT to cisgender people every single day, it's the same treatment, it's the same monitoring. But like Aoife said, if you're transgender, you have to go through a different system. You know, I think of maybe, I don't know, for example, a trans woman living in rural Kerry who might be the only trans person in the village that she knows of, having to travel to Dublin and find their way to Loughlinstown Hospital, which is difficult for even people living in Dublin alone. You know, it's not accessible, it's not good enough, and it needs to change. We need to run off a system where we're believed and not where we have to constantly prove ourselves, and a system that is evidential and international best practice.
Cool. Thank you so much for that, Noah. It actually, you very neatly kind of tied it back to something that I noticed earlier on, which is some of the similarities between the attitudes of those who are gatekeeping trans healthcare and those who gatekeep abortion healthcare in Ireland. And I guess I had a question that I wanted to open up with, and then I have a bunch of questions in the chat. But my question is, like, given the similarities that Noah and Eilís and Adeline that you all alluded to between the sort of the provision of abortion care in Ireland and the provision of trans healthcare, what can trans activists and abortion activists learn from each other in our fight to improve access to all of this healthcare? Anyone want to go first? Adeline, you're leaning in.
I think realizing that we all need to work together. I think it's when you look at any problem, whether it's homophobia or transphobia, or if you look at any of these in isolation, you fail to see that they're part of a bigger picture of discrimination. I think it's important that we all work together. We need to open our ears to other people's struggles, which can be hard when you're battling for just simple survival. But we need to be working together. We need to be listening to traveller activists. We need to be listening to people in direct provision. We all need to work together. I mean, it's all the same fight, and you know, the people who are denying us healthcare are benefiting from the kind of divide and conquer situation. So working together is the main thing. We are not enemies. We all have common goals and can very much benefit from learning from each other and working alongside each other.
Thanks. Noah, you had your hand up. Do you want to add in something there? You are muted. Kathy, can you unmute?
Yeah.
There we go.
No, Adeline is absolutely correct, and that's one thing I'd absolutely say is working together. But another thing I'd say is that, you know, these people who want to divide seem to think that you can pit one healthcare issue against another, which is never, ever helpful. Every single healthcare issue is important. Everyone deserves access to adequate, safe and accessible healthcare. And by pitting one healthcare issue against another. No one is getting any further. No one is progressing. And you know, every healthcare issue is as important as the other. Oftentimes, you'll get people saying, "Oh, why are you out there fighting for trans healthcare when there's children still on a waiting list who have scoliosis?" And my answer to that would be, that's absolutely awful. And if you decide to shout about that, I will stand right beside you and shout with you about that, because that also isn't acceptable. So, you know, what Adeline said about working together to make sure that everyone has equitable access to the healthcare that they need is so important. And by not pitting one healthcare issue against the other, because all are so important. And, you know, one healthcare issue isn't going to take away from another. You know, I'm not going to take endocrinologists away from people with spinal difficulties. It doesn't work like that. Such as rights, transgender rights aren't taking rights against women or men either. So, you know, it's working together, and it's realizing that all healthcare issues are equally as important and everyone is entitled to them.
Cool. And then Alexa, do you want to add something in? And then probably going to go to Eilís and then roll on to another question, if that's all right.
Yeah, no, I just to kind of add a little bit on to that. I think that, I mean, you know, the transphobic, the kind of pseudo-feminist transphobic discourse hasn't really latched on in Ireland to the same extent that it has in Britain. You know, it's still getting in here. There's still elements to look out for, and we still have to be vigilant, but it's not as kind of widespread and kind of entrenched almost here. And I think that part of the reason that we can almost like see through the kind of bullshit on this is because we can see quite clearly the root of all of our oppression. It doesn't lie within each other. You know, we're not causing each other's discrimination or oppression. It lies in the kind of entrenched evangelical right, kind of state powers and the entrenched patriarchy of the state. It is not, you know, as Noah said, trans people aren't denying folks access to abortion. And, you know, like, and abortion activists aren't denying trans people access to healthcare, because we do recognize, and I think that that's something that folks in Britain lack. It's the almost the kind of uniting nature of a common enemy. In Northern Ireland, we see it really clearly because it's so kind of deeply entrenched and quite visible through the DUP and the TUV and kind of, you know, even some, you know, conservative elements of Sinn Féin and the SDLP. And, you know, there's still a lot of kind of work to be done, but we can kind of see through it. You can see it for what it is in terms of this. It is pseudo-feminist. It's not based in any kind of reality.
Cool, thanks. And then Eilís, you had your hand up as well. Do you want to add?
Yeah, there's 2 points I want to make. The first point is, and I think it's very important that we remember this, and I hate even bringing them up, but it needs to be brought up. Gender critical feminists did not make the situation that we're in. This situation existed well before them. It comes from a very similar place, transphobia, trans misogyny, but they're irrelevant. But they're not even relevant. And the thing that, to tie into what other people have said, one of the things that I think is so important is we look at how prior campaigns have been run. So if we look at marriage equality, inconvenient people were kind of pushed off to the side. And it is this kind of top-down approach from activism where we'll get the big thing that affects the most people and everyone else is kind of screwed. And one of the things, I was at a talk earlier today with a bunch of traveler women. You know, when traveler women die 12 years earlier than settled women, when people in direct provision are left to rot there for years and years and years and years, we need to stand with them and all work on each other's issues. Because this is how we need to work. And this is like, if we needed to learn something from how we have done things before, You need to work at bottom-up approaches, because as a migrant, if you solve the trans people being able to get healthcare in this country, so trans people in direct provision get it, are able to access that healthcare, then guess what? You have solved problems for other trans people. So it is, I think we need to look at how we approach this, as opposed to these big top-down organizations kind of telling everyone, well, this is what we're going to fight for, as opposed to listening from the grassroots.
Cool. Very, very good. There was one other question, sort of just similar, on a similar topic, which is, you know, before provision of abortion care in Ireland, people very frequently had to travel, but there were also those who safely took abortion pills at home, which were illegal at the time. Without saying anything too incriminating, is there any way that people could share a little bit about what those options look like for trans folk in Ireland at the minute? So, Eilís, your hand is...
So, the funny thing is that those networks that were importing abortion pills through the Repeal network into Ireland and into Northern Ireland, those networks still exist, funny enough. You know, I'm very carefully couching what I say here. If certain steroids are legal within the UK market, so I know of people who do it that way. I know that there are a lot of people in this country that self-medicate. I will be honest, I self-medicate. I'm not going to tell you how I get it, but I get it. Because you know, this is this kind of thing with punishment punishment only works if the thing that you're doing, the reality of not doing it is worse, is less worse than the punishment. So if they're going to punish you for it, okay, what are you going to do? You know, this is the only way I have of accessing healthcare so my bones don't turn to dust. If you'd like to give me an alternative, please. I've been begging one for years. If they're not going to do that, then I'm going to do the things I need to do in order to survive. And if they'd like to yell at me at it, I'm sure they know where I live.
Is there anyone else that wants to sort of come in on that topic, or Addie?
Well, I moved to the United States when it was still illegal to even be gay here, let alone anything else. And one of the reasons I moved to America really was because in the movies I saw trans people who weren't being treated like I was growing up in Tala in the 70s and 80s. And in the United States, I moved back to Ireland with prescriptions for HRT. I was being seen. I actually haven't been seen by an endocrinologist since I left Texas. But on the lead up to getting HRT, I did actually get medications through the black market. But the reason it's so important that we get seen by an endocrinologist is my hormones almost killed me from, I got blood clots and almost died from them. So now I'm constantly on blood thinners. So it is really important. I mean, you can get them, and I might just be one of those people who's just incredibly unlucky. But it's something that's worth bearing in mind. You know.
Cool. Thanks. So with the consciousness that we are coming up to 15 minutes left in the panel, I want to move on to a couple more questions. So there have been several questions on the topic of what is the best thing that sort of cis allies can do to help, or what are the best ways to fight transphobia in schools, that kind of thing. So really quickly, who has some words of wisdom they want to share? So Noah.
What I'd say, you know, something I say quite often is until all of us are equal, none of us are. And, you know, I think by having that mindset, it can keep reminding us of how important it is to keep fighting for the rights of those, you know, even if you have those rights, to keep fighting for those rights for people who might not, because until we're all equal, none of us are. And it can start by, you know, we need education in our schools, adequate education in our schools. Our kids don't learn about different gender identities. So if they end up being trans, they grow up thinking there's something wrong with them. If they end up growing up gay, you know, they grow up thinking there's something wrong with them. And attached to like this non-education about these things that are perfectly fine and perfectly normal, people grow up with this immense amount of shame, which really, really, you know, can have a real big impact on their mental health and their lives going forward. If I learned what transgender was when I was 12 or 13, I wouldn't have had to travel to Poland to have a double mastectomy. You know, my life would have been so much easier, much happier from much earlier on, had I known, you know, there was such thing as transgender before I hit puberty. You know, I'm a gay man. I never learned about, you know, any sort of gay sex or education or any sort of, you know, that gay people even existed when I did sex education. In our schools today, they're still separating boys and girls when they talk about periods and erections. Boys need to know, you know, about reproductive health. Boys need to know that as well going forward in life, to be informed and to be educated. You know, girls need to know about boys' sexual health and boys' reproductive health as well, because if we keep separating our kids, when we're learning about this, they're only learning one half of this type of education. So it starts in our schools, it starts with our kids, appropriate, inclusive sexual health and health education, and that's where it begins. But what other people can do as activists is, you know, if the transgender community say, we need your help, we're not just saying it. You know, we're a small army. We make up 1 to 2% of this population, and we need other voices to join us. And we need meaningful change. And you know, we can achieve that by all joining together. If we have a protest, turn up to it. Obviously not in these times. You know, if we ask you to write to your TD, we need you to write to your TD. You know, and such as any other section of society. You know, quite recently we've been seeing a lot of racism towards the traveller community coming out. If they say they need your help, they need your help. And, you know, by joining together, you know, until we're all equal, none of us are.
Cool. And then Aoife, you wanted to add something there really quick?
Yeah, so I agree with Noah. I mean, like, I've been on several trans healthcare marches, and I see the same people every year, and it's usually trans people and their families. Like, I know a lot of trans people marched for repeal, and, you know, we need to see the same sort of commitment from our society, you know, marching with us when we have our marches for trans healthcare. But I also think panels like this are very important. I mean, I think it's great that ARC are holding this panel. Like, I've seen a lot of trans women included for International Women's Day on lots of panels that are happening, and I think that's wonderful. And I think it sends a message out to your nearest neighbour that what's happening over there will not be tolerated here. So I think it sends out a very, very strong message, as you've probably seen on your Twitter feed since this went out. So yes, I think things like this are very, very important.
Was something going on Twitter? Cool. I want to move on and just I want to move on and just keep getting through some of the questions, because there's actually been some really, really great engagement. Thank you, everybody, for the questions. So we had an audience member who shared details of their awful treatment at the National Gender Survey in Loughlinstown, saying that they, the way that they were brought up and that their autism were cited as reasons for their being non-binary. Their question was, can you be sort of discriminated against at work in Ireland for being trans or non-binary?
No.
Yeah, I think I'll take that one.
Trans people are protected of the 9 grounds of discrimination in terms of employment. I think you said that this person asked about in terms of work, is it, or healthcare loan? Yeah,
in terms of work.
Gender is protected under the 9 grounds of discrimination, and if that person has experienced that, I would highly suggest, if they have the means, to get onto a solicitor. If not, to advice from FLAC, which is the free legal aid organization. So no, absolutely not. You cannot be discriminated in a workplace or attempting to get work based on your gender identity.
Cool. Alexa?
Yeah, just on the Northern Ireland side of that, basically same situation. The reality of a lot of anti-discrimination legislation is that discrimination still happens, and it's often really hard to like enforce and take through the courts and get money to do that, and all of these different caveats. But the Equality Commission has taken transphobic discrimination cases in the workplace in the past. So yes, no, same thing. If you need support in that regard, you can contact us or the Equality Commission.
Cool. Thank you so much. One follow-up to an earlier question about what it is that cis allies and other activists can do. The question is, when we're looking at these systems that enforce oppression and gatekeeping, where is the greatest leverage or opportunity to drive change? Is it politicians, the health department, GPs, or courts?
The HSE, in terms of South of Ireland. Politicians don't have much pull. I mean, we can speak about it with politicians, and getting these things right on the floor of the Dáil is essentially what's going to bring media attention to it, which puts pressure in turn on the HSE. But the HSE essentially are the people that can change this. The HSE run the National Gender Service, but it's not the HSE that's running the National Gender Service at all. It's the other way around.
Cool.
So it's putting pressure on the HSE to change things and to start abiding by international practice.
Cool. Then Addy, it looked like you wanted to come in.
Yeah, also talk with each other, spread the conversation. I mean, just from my experience on and trying to make change, working through the system and working with the Gardaí, for example, it's incredibly difficult, and they're not systems that are designed necessarily to help us. I mean, these are the systems we're being crushed under. But what will make change is pressure from the people. So spread these conversations. Remember, we're the canaries in your coal mine, and talk to each other. And when you're hearing misinformation, respect us. I mean, we're exhausted, but approach us in a respectful manner. We'll be happy to direct you to the correct resources if you're getting incorrect information. But start the conversations, open the conversations, challenge the misinformation.
Oh, thanks. Aoife, I think I saw your hand up as well.
No.
Okay, then I definitely saw Alexa's hand up, and I know Eilís, you've got your hand up as well.
Yes, just quickly, something that I may not have mentioned in the kind of main part was the recent legal ruling on access to puberty blockers for under 18s in the UK. The very bad ruling. Thankfully, it only applies to England and Wales. Not thankfully, we have still heard of people in Northern Ireland being told that they will need to obtain a court order in order to access puberty blockers or in order to access hormones under the age of 18. So I do think that there is going to have to be some litigation on this. I do think there are policies that are being made and kind of upheld almost like off a whim with regards to trans healthcare in Northern Ireland. So I do think that it is going to come down to litigation at some point. But kind of apart from that, most of it relies on the Department of Health to change anything. The Minister for Health, Robin Swan, to push civil servants who are incredibly obtuse and kind of unwilling to cooperate with trans communities.
And then Eilís, you had something?
Yeah. One of the things that we keep seeing is this kind of attempt to import the media dialogue, if you want to call it that. It's basically, the British media beats up on trans people on a daily basis. And we keep seeing recently this attempt to import that in here. So I think like one of the things that we have to be very kind of aware about is there are attempts to do that, and they need to be resisted, letters to the editor, etc. But it's really important that the dialogue that is happening here is not the one that's happening over there, because that is just toxic and vicious.
I know that there are some well-versed letters to the editor-writers in the audience, and you know, people who are very well versed in that. So that's something very clear, and it's actually quite a low investment, low sort of effort way to take part. A step up from retweeting on Twitter, but a step down from anything else. Noah, one more point, and then we'll move on to another question. Thank you.
Yeah, this is actually just going back to one of the, it's something I didn't mention in one of those first questions there, that I think will be really relevant to mention, is that, you know, I'm a man, I'm legally a man, I am a man, but I'm a trans man, so I can still conceive. I still might need access to abortion at some point in my life, I don't know. But it's really important to note, you know, with the review of the legislation coming up, that it continues to say solely women in that legislation. So technically, if I needed help and I needed an abortion and I ended up with a consultant who was completely transphobic, they can legally deny me abortion in Ireland, even though the legislation is there, because I'm legally male and not female. And the legislation says only women, and I'm legally male. So if I come across the wrong person on the wrong day at the wrong time, I can very much legally be refused abortion services in this country, despite the fact that I can conceive and still might need to avail of abortion services at some point. And I know that's not relevant to this question, but it is something that I didn't get in there at one of the first or second questions there. But I think that's a really good point for us to keep in mind going forward through this review of the legislation.
Cool. I do just want to very quickly call out that we're coming up to the end, and I don't know about you, but I'm learning a lot and I'm really enjoying the conversation. So if people will be willing to stick around, we have a few more questions. Just shoot Kathy a message if you got to run off, and that's fine. While we're waiting for that, there was one question I wanted to get to just before we ran out of time. The question came in to the chat. I don't know who it's from. It's completely anonymous. The person was saying, I feel like I can't open up to my GP about how I feel because it's always the same doctor. Where else can I go to talk and open up? What are my other options? Aoife.
Yeah, so on that, so before I went to my GP, I went to a counsellor. So there are counselling services in most towns around the country. Some of them operate, a lot of them operate on a pay what you can afford to pay. So the one I went to was a pay what they charged €50 an hour, but if you couldn't afford that, if you're unemployed, you could pay €10 or €5 depending just on what you had. So yeah, talk to a counsellor, talk through it with a counsellor if you can. It took me 2 years of that, and then I went to see my GP and told her that I was trans. So I would definitely recommend speaking to your counsellor if you can.
Cool. Noah, you're still muted there.
I don't know where in the country this person is based, but I can give a couple of suggestions in terms of kind of knowledgeable mental health professionals if you wanted to talk it over. There are a service such as, it's called Insight Matters. They're very experienced with trans identities and things like that. They do offer low cost counselling and do negotiate on price. You go to your GP and ask for to a mental health team. You don't have to say anything about your trans identity, but that you just need those services. In terms of if that person wants to go forward for medical care but doesn't feel like they can say it to their own GP, I can suggest in any way there's 2 GP practices that are really good with trans healthcare, and they're really knowledgeable about trans identities. One is the Temple Bar Medical Centre. I know she's also great with reproductive health and things like that. And then there's also the Whitworth Clinic in Drumcondra. The GP practice there is super trans friendly and super knowledgeable. But even if that person wants to get in touch with me privately, feel free to, or at TENI.ie. I can signpost them depending on where they are in the country.
Cool. So we're in a year this year where there's going to be a review of the abortion legislation, and as Noah called out, there's a couple of changes that need to be made to that legislation to make it more inclusive for people who are able to get pregnant. Not everyone is covered. There was a review by the Healthcare Steering Committee of the transgender care model, and the current model is up for consideration. Are we likely to see any changes out of that?
No, not very soon. So I was a sitting member of that committee. The majority of what we were looking at on that committee was developing a Ireland-based service for children and adolescents, Irish-based healthcare service for trans children and adolescents. Because as many people, or some people won't know, is that service has been provided through the Treatment Abroad scheme by a clinic in London called Tavistock. Now, Tavistock contract ended with the HSE. It was always due to end on the 21st of January 2021. The media have skewed it a bit and said that the recent ruling in the UK is the reason Tavistock pulled out of it. That's not the case. They were always due to end their contract, which is why this committee was set up to set up an Irish service for children and adolescents in Ireland for when that contract ends. But unfortunately, we concluded that committee last January of 2020. The report was submitted to the Department of Health in February 2020, and unfortunately, it seemed to kind of be misplaced, and it was never published. And as a result, the recommendations of that committee were never acted upon. We only put pressure on the government to publish that report in around November, December 2020, and very quietly, after a bit of media attention, was published on Christmas Eve without any mention. So that's why we currently don't have any services. The young people who are being seen by that service are going to be continue to be seen by that service, but they're not taking any new referrals because there is no service now. The delay in that report meant the failure of having an adequate service set up by the time Tavistock departed their partnership with the HSE. So that means now we've got a number of trans children and young people being referred to a service that doesn't even exist yet.
Thanks for that. So a couple more questions. There was a question about pathways to care and recognition for non-binary people in Ireland. I know, Noah, you pointed out, and Aoife pointed out as well, that there are people who have their suit for going to the National Gender Service for their interviews. People are very much forced into that binary. Is there anyone that could speak a little bit more about sort of paths to recognition for non-binary people in Ireland? Because I know that you can't necessarily you must have male or female on your ID. Was that covered in the report?
No, so the Trans Healthcare Steering Committee was solely just looking at healthcare. But you are right in saying that people who don't identify as male or female don't have access to gender recognition certificate. Although it's one of the most progressive pieces of gender recognition legislation in the world, other countries look to us when creating their own. It's still a very binary piece of legislation in that you can only identify as male or female on it. So that leaves out our non-binary siblings, our gender non-conforming siblings. It leaves out young trans people. And, there was a review 2019, and our government, the two recommendations out of that review were to make access for non-binary people to the legislation, and also for 16 and 17-year-olds. Unfortunately, we thought they were both going to go through, but at the end, the last hurdle, our government turned down both of those recommendations. So non-binary and young trans people still don't have access to the gender recognition certificate.
So just then looking through the list of questions in the chat, I think we've covered most of them. So thanks for folks for sticking around a little bit longer. There's two more that I want to finish up on. The first is, given that there are so many in the community self-medicating, and that's the current status quo for trans folks, is there any power in being open about it? It seems that staying quiet is convenient to those in power. You know, I know there was a lot of shout your abortion events sort of in the run-up to repeal. Is that something that is, you know, do people have thoughts on that?
Yeah, I don't want to go to jail. You know, jail if you're a cis person sucks. Jail if you're a trans person really sucks. What it comes down to.
Have people been sort of prosecuted? I remember I'm a baby trans, and like most of my background is in abortion activism. And I know that there was the scandal in the run-up to repeal of the woman in Northern Ireland who took the abortion pill illegally, and one of her housemates found the package in the bin and reported her to the police. Has anyone in Ireland been prosecuted for performing DIY HRT, either on themselves or on someone else?
No, but I got a very, very scary letter in a brown envelope with a harp on it that told me I was very, very bad for trying to mail something to me from the United States.
Okay, cool.
I mean, I'm not that I'm aware of to that question, but I mean, it's scary. Like, it's, you know, it's hard to be out there as a trans person in the public, especially as a trans woman in the public eye anyway. And to be out there, especially, you know, kind of doing the work that a lot of us do in terms of advocacy, you know, it would be used to undermine us. You know, it is used to undermine us all the time. And you know, I'm never open about my access to healthcare, as you know, whenever delivering training sessions to healthcare professionals or whatever, because it just it does undermine it. And you know, I think there is a poignancy in kind of owning it and saying, you know, fuck y'all, we have to self-medicate, we have literally no other choice. But there is also the risk that, you know, by saying that, people will then turn around and say, oh well, they're encouraging that dangerous behavior, God forbid. So yeah, two sides to that coin.
Adeline, do you want to come in there?
Yeah, I think I don't think it's a great idea. I agree with what everybody said about sharing anything that's going to jeopardize everybody else, but it is important to share your story so you can do that or do that through somebody else. I mean, if somebody wanted to reach out to me, for example, and I could verify who they were, I'd be happy to share their story without divulging any identifying information. Because that's one of the things that really swung it for gay people. And when enough people stood up, you really couldn't oppress everyone. If we all stand up, they can't keep pushing us down. I mean, it's one of the in sex work, it's one of the parts of the machine that allows this harmful mechanism to continue, in the shame and stigma. People aren't allowed to speak up. And you see it in intersex activism too, that when we speak up, doctors will say, we're the angry minority. When you're in trans activism, intersex activism, and sex work activism, you see the same parallels over and over again. You need to stand up, you need to get your voice heard, but don't do it at the risk of your own safety. But getting your story out, I think, is important. People need to know how many of us there are. We're everywhere, you know? I mean, if you look around and think how many people there are with red hair, well, that's how many intersex people there are. So, I mean, there's a lot of us out there. So yeah, share your stories, but you know.
Thanks. That like harking back to repeal and my own experience with sort of the pro-choice activism, it was the stories, it was those personal connections that really helped change the hearts and minds. And so it's definitely something to think about. The last question, and I swear this isn't a question I asked to the panel, this is a question that came in anonymously, and I think it's one that's a nice one to wrap up on, is how come some of the best women are all transgender activists? Over and over again, you have to tell such raw personal stories that must be re-traumatizing. Wishing love and solidarity with you all. We're also lucky to be here and bear witness. And I think that is how I just want to finish the panel. Thank you so much for sharing your time and sharing your stories with us today. And thank you as well to Aoife, who had to leave and go to another meeting. Very busy day for her. And then thanks to all of the participants, all of those attendees who listened and shared their questions and shared their stories with us. Thanks, everyone. And, you know, we hope to see you on the march for better trans healthcare, north and south of the border, and also in the letters pages.